Divine Justice Ministry with lawyer, professor, and minister, the Reverend Tony Suarez, as your host. The crossroads between law, the Constitution, and religion, where the First Amendment is always the first topic of discussion.
Good morning.
Welcome. I am the Reverend Tony Suarez, host of the Divine Justice Ministry, with my co-host Steve Alcino, and this show dedicated to explore the crossroads between the law and religion, and that is where the First Amendment is always the topic of discussion and freedom of religion. Welcome, Steve. Good morning.
Good morning, Tony. Good morning. How are you doing today?
Well, I'm happy, ready, energized, hoping to discuss, something that we briefly talked about off the air, but streaming to where hopefully that I'll be able to bring to the public an explanation of what is the topic of today is going to be a conversion therapy. Conversion therapy, and then you're going to be asking, well, Tony, what is conversion therapy? Right? What does that mean? All right. So that's what I want to talk about because, again, we're exploring here in this show always what is the crossroads between what is legal and what is moral. Things that are morally correct that you have to follow because that's your morals, and things that should be legally correct because that's what the law says, whether it's moral or immoral. Laws can be immoral, for example, we've had slavery in this country and it was considered to be okay. It was legal slavery, but was it morally correct? All right. So you have just because something is the law doesn't make it morally right, and something because it's morally right doesn't make it legally right. All right. So there's the crux, and that's what we'll be discussing. And what I was hoping to discuss today is this concept of conversion therapy, and what that basically is it was brought to the Supreme Court in a case, an actual case, and that's what I want to talk about. So let me first state what the case was about, and then we can discuss what the court did with it, and we can discuss what we think about it. All right. The case turns around a doctor, a licensed clinical practitioner, licensed in the state of Colorado. And what she did is she would announce herself that she would be able to, for a fee as a licensed practitioner, licensed psychiatric practitioner, that she would provide persons who think that they're gay or think they're transgender and therapy in order to become normal, right? And because of the concept that, of course, if you're gay, you must be not well, and therefore you can be converted by proper treatment. And so she started this practice, and then in the state of Colorado, the legislature decided, wait a minute, this is not right, and they made it illegal. They wrote a law saying it was illegal for licensed practitioners in the state of Colorado to offer conversion therapy, right? This type of therapy. She then brought a lawsuit. She sued in federal court the state of Colorado because she has a right of free speech, and she has a right to speak her mind about what is normal, what is not normal, and what is how we can convert you, into normal behavior. So she brought the lawsuit as a violation of her rights to be able to say what she wants during the therapy. Now there comes the issue, right? She has a right to free speech, and the government has a right to control its professionals, right? Nobody doubts that the government has a right to license doctors. We're not going to give a license to anybody. I can't apply for a license. I have to have requirements, right? Everyone has. There's no doubt that the government, the state government, has the right to license its professionals. But can they license their professionals to the point that eliminates their First Amendment rights? Right? That is the question that has to be questioned. So before we get into the legalities of it, I wanted to talk about what is normal. All right?
What is normal?
What is normal? Okay. So, on many occasions, you and I have discussed, Steve, and you said that we were based on your moral beliefs.
Hmm.
That God made Adam and Eve, not Adam and Steve,
That's right.
and therefore, based on those moral beliefs, um, uh, what's normal is a man and a woman, not a man and a man or a woman and a woman. That's not normal. Now,
I didn't say it's not normal.
oh,
Okay.
uh-huh.
I say it's different to
Okay.
what I believe.
Okay. Okay.
Today, and I don't want to take you off subject, but
Right,
what
right.
is normal? So what do we consider? What do we consider? Excuse me, my French. Normal.
Okay. Well, that is what when the government gets involved and starts making laws, right? Thou shalt not kill, or you should not murder. So we'll say, okay, you can kill, but under certain circumstances in self-defense. You may not murder means you cannot kill somebody without having justification. That's a law based
Okay.
on some sort of government decision that people shouldn't be killing each other and there should be consequences for killing. So laws are based on moral values of the majority of the people that live in the jurisdiction, whether it's a federal law or state law. And so the laws are made by the moral values of the majority. So if the majority believes that homosexuality is abnormal, right? Is abnormal. Therefore, we want to stop it because it's bad for society. And since we're in the majority, we want to stop this. Let's write a law that says anybody who thinks that they're gay or thinks that they're transgender, we have to submit them to doctors to get them to think straight. You realize, Steve, at one time in this country, being gay, you had to be in the closet, right? That's because not only was the law against you, society was against you.
Yeah.
Right? So being gay, you had to hide that. Famous people like J. Edgar Hoover, who was the FBI director, right? Was violently anti-gay, and yet he himself had tendencies they would dress as a woman and stuff like that. So you have dozens, if not hundreds of stories about people like that. So at one point, what was normal was what society, and then they used the law to impose their view of normal and their view of morality upon everyone else. So then people start suing and say, wait a minute, you're imposing your morality on me. You're imposing your morality on me. Remember last time we spoke about transgendered schools and so forth, and that topic we as to whether or not the transgender community and was forcing the religious community to listen to opinions about transgender LGBTQ lifestyles, and they sued and said, you can't force me to listen to that, right? And so that was one attempt by a group to liberalize what is normal, and as opposed to some people that I don't want to know about that normal. My normal is different, and I have a right to maintain my version of normal. And you're forcing me by law. You're forcing me to accept LGBT lifestyles. So now we have a situation where the state is saying licensed psychiatrist, therapist, you cannot give conversion therapy. And the therapist is saying, wait a minute, what about my free speech? Don't I have a right to say what I want to say? And give counsel to people, help them get straight if that's what they came to me for, right? Don't I have that right? And that is the question that I want to explore today. And I'm hoping that people make comments and when they listen to this thing and see it on YouTube, on Facebook, make comments, because it's important that people understand this, because what we're discussing is not what is right or wrong. You have the right, right? You have the absolutely constitutional right to express your opinion. The question that we have here is whether or not we can use the law to force your point of view. Can we use the law to force your point of view? And that's back to the classic question of the First Amendment that says that the government may not impose a religion upon us, nor may the government impede or make it more difficult for you to practice your religion. So it may not impose a religion, it may not make it more difficult for you to practice your religion. That's the First Amendment, right? Neither impose nor impede. So now, when is that line crossed? When is it that the government has gone too far, either establishing or prohibiting the free exercise thereof? Where is that line? And that's where I think we're going to get to eventually and discussion of this case. So let me get your opinion, Steve, right now. So have I made myself clear?
I hear you. You are clear as to what you're trying to convey.
Okay.
There's differences in, like you say, there's the right where my right starts where yours end, and yours starts where my end. Does that make sense?
Yeah. Yes. Yeah. Yeah. Go ahead.
So, we all have the right to express ourselves. We all have the right to be loved. We all have the right to, have a family, be happy in whatever way we want or make us as individuals. When it comes to this and the difference of genders and religions and what does it mean and where are the rights of that individual and how it conflicts with what's going on today, what you're trying to convey here, and the assistance of individuals to be taken out of that way of life. A lot of stuff, my friend.
Okay. Let me draw this out from you then. I know you haven't you don't know about the case. I just briefed you about the case, but
Yeah. I was reading it.
You think that there's a difference between Steve giving his opinion as to what is a transsexual, what is normal, as opposed to a licensed therapist, a state licensed therapist? Is there a difference?
Yeah.
Okay, so do you agree that the government has the right to license professionals like therapists?
They have to. They have to make sure that they have the credentials and education that they need to be able to provide the service which they're licensing or asking for license for.
So do you think that it would make a difference if this therapist was announcing, come to me for spiritual treatment about your homosexuality, as opposed to come to me for a fee as a therapist for treatment for your homosexuality?
Run that by me again, please.
Yes. Come to me. I'm the therapist right now, and I write an ad. Come to me for spiritual treatment on your homosexuality, or article says, come to Dr. Suarez for therapy on your homosexuality. Is there a difference between those two?
Oh, buddy, it has to be a difference. Okay, because one is a doctor and the other one is
just
not.
Exactly. So one implies just a personal opinion, and the other one implies a professional opinion, right?
Yes.
So if the law says a licensed professional may not offer conversion therapy, is that something the government can do as opposed to say the government says no one can offer advice on conversion therapy or homosexuality. There's a difference, no?
Yeah. Sorry. But
one is saying is regulating the doctors, and one is regulating speech in general. So if the government says you cannot, no one may offer consultation on homosexuality for conversion. No one. That means they're going into your speech. They're going into my speech. But when they say that a licensed professional in the state of Colorado may not offer conversion therapy, now what they've done is restricted it to the area of law that an area which they are allowed to, which is the regulation of professionals, licensing of professionals. So this particular case came down to that. So the conversation is, where is the therapist's right to First Amendment being impinged upon? The answer will be no, you have the right to express whatever you want individually, but you cannot express an opinion as a licensed professional that you offer conversion therapy, because therapy is a licensed practice and it has to be followed under the licensing rules, right? And therefore the government has a right to determine what therapy is right and what therapy is wrong. The government, for example, can say, you can use methadone, but you cannot use codeine. You can use this kind of pill, but you cannot use that kind of pill, right? The government controls therapy all the time. Whether it's the type of medicine that you use, the type of practice that you use, is controlled by government that gives the professions guidelines on which they can practice their professions. So a dentist can do dental work, but he can't operate on your liver, right? Because he's not a licensed generalist. He's a dentist. So there's no question that the government may control the type of treatment and even the medication, and how you apply medication, with an injection, without an injection, they can control that kind of thing. What they cannot control is your opinion personally, but they can control what therapy you're offering. So in the case of Colorado, what this came down to, Steve, was what was the announcements? What was the marketing technique of the therapist? Because she marketed herself as a licensed therapist offering conversion therapy, the court said, wait a minute, you're using your licensed credentials to offer a therapy which is not accepted in your industry. You can have whatever opinion in your church, have whatever opinion you want in your church, right? But when you come out and say you're a licensed clinical therapist and you're going to offer a therapy, you're trying to make yourself different than just Reverend Tony. Reverend Tony can talk all he wants about psychiatry. Yeah. He's not a psychiatrist. But if I say I'm Dr. Anthony Suarez, a licensed clinical technician, and I'm going to help you clear there's a difference, right? So when she advertised herself as a licensed professional, and she was using this therapy, that's when the court says, wait a minute, let's look at what is therapy. So if you go into the court, what is therapy? What is the type of therapy? They describe therapy, and what does it mean to have a therapy, and how can they control? And the court determined that therapy means that you have to have a sickness. When you're going to have therapy, you have to have a sickness. You have to have a diagnosis of a sickness. And there is no therapy, there is no definition of homosexuality as a sickness. You may consider immoral, but as a sickness, there is no evidence scientifically that being homosexual is a sickness for which you can be treated. Okay? So because there's no sickness, there is no sickness, no definition of sickness, you cannot offer therapy, which is what licensed professionals do, offer therapy. And if there's no sickness, how can you offer therapy for something there's no sickness? If you want to convert, go to church, license, offer yourself as a reverend or something, and then talk about conversion therapy. But don't advertise yourself as a licensed clinical therapist in the state of Colorado or anywhere else, because this has gone up to the Supreme Court, right? Don't advertise yourself as a licensed therapist that you're offering a therapy which is not accepted or respected by the industry that you're in, the profession that you're in. And as a result, the court struck down her case, saying that she had been violated her First Amendment rights. And said, no, your First Amendment rights of free speech have not been violated. All the state did, all the government did was control what you do as a professional for a therapy that does not exist. You cannot do that. You go out there and do what you want, say what you want as an individual, but not as a licensed therapist. And that is how these cases get resolved. I know this is kind of heavy, it's difficult, but that's why I'm doing this, Steve.
Wow. You got me over here, and it was like, wow, that is. I did not know that it had so much to do with what you just explained. And I'm over here like, blah, 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 because, in other words, she cannot do or advertise like you said. Dude, this is crazy. So let me ask you, finally, what was the verdict, the final verdict? The last word. What was the final judgment?
The final judgment was she did not have a case. The doctor, she sued to strike down the law as being unconstitutional because it violated her First Amendment right. So the court ruled that the law is legal. The law is constitutional because it did not violate her First Amendment right. It did only control her licensing, her profession, which is within the power of the state. So her case got thrown out of court.
That's it. End of story.
Right.
Interesting. Very interesting.
I'm telling you, I wanted to, when I was talking about, show this little image, because what happens, Steve, as I wrote a paper on this, which those of you who are interested, you can go to the website. You see that my website right there, and the articles are there, are posted there, so you could read the actual article as well. So this question of whether you are gay or not gay, whether you feel comfortable within your body, is something we discussed about in the last show when we talked about transgender education in public schools, right? It's confusing, particularly as you're growing up. As you're growing, your body's changing, and you're trying to understand where you are. Now, I think it is my belief that while you're born with your DNA, right, your deoxynucleic acid DNA has the chromosomes, and the chromosomes tell you whether you're going to be born a male or female. The problem is that all of us have different likes. You like blue, I like red. We all come up with different likes, and that's because there are differences in the chromosomes. And I believe that those people that are, and I believe because I think this is talk about normal, we've had homosexuality in every race and in every country in the world. There's not a country that says there are no homosexuals.
That is true.
There's not been a period in history that we've had no homosexuals. I mean, some of the greatest warriors, like Alexander the Great, were gay or homosexuals, right? I mean, there were many examples of being gay and the homosexual lifestyle, thousands of years, and in every race and in every country. So therefore, it seems to the conclusion that this is a normal practice of DNA. Now, how this expresses it, how your gene, your sexual gene expresses itself, may be different with everyone, and then you get confused. I think that people have to come to that conclusion their own and not say that my normal is normal. Listen, you can't be left-handed. Oh, but my left hand says I need to right. No, no, no. Don't use your left hand. You have to use your right hand. And that's my normal. That's not your normal, right? And you indicated in the previous show that you're left-handed. But you remember when they were trying to force you to use the right hand as opposed to the left hand, because that was normal back then.
Yep.
People are confused and they don't know what to do in with their future. The question when we passing laws, are we passing laws that reflect only my normal as opposed to somebody else's potential normal? Even if it's a small normal, most people are right-handed. Only a small portion of people are left-handed. But we now recognize that being left-handed is just normal. It's normal for them, you know? And so we cannot pass a law to make it illegal to write with the left hand or give a benefit. People with right hand, they get an extra tax break. Why would you do that? Yeah. So we can't do that. We can't use the law to change the DNA of what is normal or what's normal for everybody else. Then we have to re-examine what we believe is normal and how far we can use the government to determine, because everyone looks at themselves and determines what they believe they are. And in the book that we spoke the last week when we did the transgender books, there was one story of a young girl that is a family. One, they have a girl and a boy, but the girl expresses to her mother, "Mom, I want to be a boy. I want to be a boy." And then the brother says, "You can't be a boy. You're a girl." And the mother says, just embraces the daughter and says, "It's about love. It's not about sex. It's about love. We love you, and we're all going to love each other, and you can be whoever you want." Right? So now that was an expression in the book, an expression of acceptance of that transgender or homosexuality feeling that daughter was having. In that case that we discussed last week, and of course you can find it if you want. In the website or YouTube, you can find that on YouTube. The court felt that the parents of the straight people don't have to listen to that, and they shouldn't have to listen to that. Now we have a different point of view, is where the conversion therapy is being forced upon people who are gay. But what you are is what you feel you are inside you. Because, again, from a minister point of view, I believe all of us are manifestations of God. We are individual manifestations of God. And if we're a manifestation of God, then you are perfect the way you are.
Right.
And so therefore, don't try to be me, or don't try to be something that you're not. Be who you are, because you are a manifestation of God. And as such, you should just act the way you are, and we all have to love you. That's what we need to do.
You're right, because we love the sinner, not the sin. Okay. I'm not here to judge anybody. I love you for who you are, and that's the way we should live. That's the way it is. And what you said about it's actually in the Bible, Psalm 139, which it tells you that the Lord knitted you and He created you in His image inside your mother's womb. And that gives you an idea and an understanding on how important you are as an individual to God, that He personally needed you in your mother's womb and created you. We are all chosen. That's why we're here. We are the ones that need to choose which way we're going to go. So I don't know why I'm frozen. But.
The opportunity, Steve, to talk about my book, okay, which I cover many topics like this. All right. Now you can find it on Amazon, and you can purchase it on Amazon if you want, or you can go to the website, and I have you can go chapter by chapter by chapter and listen to my voice as I read the book and talk about the book chapter by
Really
chapter.
awesome.
This way, if you don't want to buy it, and you have the patience to sit there on the internet and listen to me, then you can chapter by chapter you can cover this book. Otherwise, I forgot what the price is, but it's less than $15. You could buy the book
That's awesome that
on Amazon.
you can also listen to it, directly from you without
Yeah.
having to purchase. That's pretty cool.
Yeah. And so I try to do in the book is I cover many topics of which we will be covering in this podcast. Okay, whether it's gay marriage, whether it's abortion, and I'm hoping to set up for next week a question about the assisted suicide. Suicide is a taboo topic in many societies, and particularly in Christian societies. And so the question is. Should we legislate it? Should we prohibit assisted suicide? And you may have, there was a Dr. Kevorkian, I don't know if you remember.
I remember him.
So in the book I cover Dr. Kevorkian, and when we'll be talking to Dr. Kevorkian, the cases that he generated, and so we can discuss the moral side of the legal side. All right. So we'll talk about the legal issues in the First Amendment, but we also will talk about the morals. The morals are, and everyone has the right to have their morals. I mean, they better repeat this over and over again. Everyone has the right to their moral decision. The question is, do you have a right to impose your view of your morals on everyone else? And that is the tricky question. And it's a tricky question in every topic we will bring, whether it's prayer in the classroom, whether or not we give scholarships to students that go to religious schools using public money, right, to go to a private religious school. There's all sorts of different aspects of this clash of the First Amendment. And I'm hoping that together, you and I will be able to bring some of this attention to the community at large.
Very, very interesting, and you learn something every day. And today has been a day that I've learned a lot, because you have a circumstance, a situation here that we're discussing, and you open my eyes to other aspects of the law, which it's fair. It sounds fair, but do we want fair, or do we want what is right? Do we want what is normal, and what is normal?
Yeah.
And that's when I get all lost, because I understand that everybody does have the right to do, believe, and feel, but I also have Christians believe that go against some things that you've mentioned. And but I learn,
Yeah.
and I see where does the individual fits in, because it's about the individual. Okay, regardless of we pass the law, if we create the amendment, it's about the individual. Why is the individual? How can we help the individual? How can we become a better society? How can we become better human beings? You know, and
Well,
if
let's use the last couple of minutes then, Steve. I finished the topic and the lecture. Hopefully, people will understand it. Give your comments. Send me some comments. I'll read the comments, and maybe we can make another show following up on this thing. But this is an example. Click on the comments. Show screen. Show screen. I don't know.
I like that. I
I'm
like
still
that.
learning the technology here, Steve. So I don't know. I got a message here that says comments show up on StreamYard. This is an example. Click on the comment to show. I don't know. So I don't know when even that little box is. But let me use this this opportunity to discuss that Steve and I are doing a series of shows every week. One we call Raw Talk, and we're trying to do that on Tuesdays, and that's pure politics. All right, and nonpartisan, neither Republican or Democrat. We will piss on both sides. Okay, so, but it's politics is evolving our community in general, whether it's from Washington or here in Florida. On Wednesdays, we're doing the Divine Justice, where we talk about the crossroads of the First Amendment, religious freedom. And then on Thursdays, we bring Equal Justice. That has to do with legal issues that affect Puerto Rico, but actually can affect the country when it comes to, the equal justice, the 14th Amendment of the Constitution with equality, the equality among citizens, right? Equal justice under the law. So those three shows, all complementary, different sides. I try to bring the professor side to it, and Steve represents the people, right? he represents the people because his job is to check me and say, what are you talking about, Reverend Tony? Okay. And I think that's important, an important aspect of to really be maintain our humility and to also to have a good show. I want people to question. You have a right to question, and if I don't have the answers, then maybe I don't know, and I'll tell you I don't know. But of course, we can explore. The whole thing is not to say I know everything, because no one knows everything.
That's right.
True knowledge is to admit you know nothing. So said Socrates. Okay. So,
Yes, sir. And yes, sir. Yes, sir.
all right, Steve. So to me, that's the end of this show. And if there's anything you'd like to say before we say goodbye.
Well, yes, I would like to say thank you for everything, for the information. I really appreciate all the input and all the teaching that you do when it comes to the law and what's going on in our daily lives. So that is crucial, and I appreciate that. The time that you take not only for this space, but the time that you take on your private life to be able to create these spots and be able to bring all this information. People don't realize that, it takes a lot of time to create a small block of information where we can go back and forth. So I want to thank you for that. Unfortunately, my Facebook did not come out, so I'll guess we'll post it or repost it, or you can post it on my Facebook, because yours is working fine. Mine is not, but that's okay.
All right, man. Paul, God bless you. And we'll see you.
Yeah, I want to thank the people who are going to listen to this, and please feel free to comment, and we'll see your comments. We'll answer your comments, and we continue to do what we love, which is bringing information to the community for their benefit. Thank you very much for coming, Tony.
Okay.
I appreciate you. Thank you very much. God bless. See you soon.